I've had 3 facelifts.
Tell us a little bit more about it.
It's officially 24 hours since my surgery ended. You can definitely see great jawline and just a lot of swelling right now, but not as bad as I thought. So I'm pretty happy with it. Just did some hyperbaric chamber, have some Vaseline on here, about to do some more icing for the swelling. They took about 1 centimeter for the bluff. Thank you, Snake Eyes, because that would have been 3 centimeters years ago. And I am actually so happy with day 1. So there's my update. The only thing I have is pain in a headache and just feeling that stretching. So it's a little bit achy because of all the muscle work they did. But oh, look at this neck. So good. Day 1, smashing it.
Today we're talking about facelifts, deep plane facelifts, neck lifts, lip lifts, brow lifts, facial rejuvenation, surgery abroad, recovery, swelling, scars, and numbness, and why facelifts are starting to feel less like something people do later in life and more like another beauty trend. And I think that's where the conversation gets interesting. Because for a long time, a facelift sounded like something older women did quietly. It wasn't talked about openly. It wasn't content. It wasn't a journey people filmed day by day. But now, people are documenting everything. The consultation, the flight, the surgery, the bandages, the swelling, the scars, the tape coming off, the emotional breakdowns, the before and after. And when you see enough of it online, even a major surgery can start to feel casual. Like it's just the next step after filler, the next step after Botox, the next step after facial balancing. But a facelift is not a small beauty appointment. It's not lip gloss. It's not a facial. It's not a little touch-up. It's surgery. And I think we need to remember that.
I got a facelift and lip lift at 28 years old and we're on day 20. Today was a huge turning point because look how far we've come. Down this vitamin C and oh my god, it was sour and I actually feel comfortable enough to wear normal glasses.
Today is finally the day I can take these tapes off and we're gonna do it right now, right now. I don't think I've ever been so excited for something in my life. I'm scared I'm gonna like rip all of my hair out. I'm really concerned about this fold right here. Headband is going in. It's literally so bright in this room, it doesn't help at all. I've got like a wet flannel. So I'm gonna like press that on the edges just to like start to peel it off. What is worrying me the most is this puffiness under the eye. Hopefully that all just goes oh, when I take these tapes off and drains away. Okay, are we ready? Soon. Oh my god. Hey, it's not that bad, it's not that bad, it's not that bad, it's not that bad. It's bad, it's bad, it's bad, it's bad. Oh my gosh, that feels so fucking weird. Okay, I don't know how I feel. I don't know how I feel. Oh my gosh, I think I'm gonna cry. Oh, okay. Okay, don't cry, don't cry, don't cry. You can do this. Oh my gosh, this one hurts so much more. Oh my gosh, that's really weird. It's like numb under the tape. Oh my gosh, I don't even want to look. I don't even want to look because I'm going to cry. Okay. Okay. Okay, no, okay, it's looking good. It's just the hairline, the folds, but no, okay. It's not as bad as I thought. Okay. It feels so weird. It feels like it's dropping on the floor. I love it. I do love it. It makes me emotional, but I do love it. With the hair down and we're covering those folds, I think it looks good. No, I think it looks really good. I can already feel that under eye has gone down so much. Oh my gosh, guys.
Today is the 3rd day of surgery and thankfully I'm not as swollen as I thought I would be because normally the 3rd day is the worst day with the surgery that you get really swollen. So I'm pretty good. I see a bit of yellows here, no blacks and blues, but not much more swollen than yesterday. And make sure when you go to surgery or even after that, because you don't want to put it through your head, you have an open front shirt because it's much more comfortable that way to take it on and off. No showering, obviously. Let's see, I don't have any pain. I'm not taking any painkillers. I love these no sugar Jello snacks. They're easy to swallow. And delicious. This is apple. I got it in different tastes. And you can have it anytime throughout the day. During this time, throughout the surgery for the first few days, you can't have any real solid food because you don't want to really chew and bite on your jaws and it hurts the throat and everything. So stay away from solid food and drink as much juice as you can, pineapple juice, and jellos, puddings, soft. And I also smashed some eggs with a little bit of butter, really small, really smashed, and had it, and it's delicious, good, nutritious protein food.
Okay, so today is day 4 of my facelift recovery. I feel like more energized. I feel like I don't feel as groggy today. I am gonna get my head wrap removed, which I'm really excited about because my ears have been hurting me so bad. So I'm excited to see how the swelling on the side looks. Since
Şimdi şey dedi zaten, bizimle alakalı bir... Okay. Hepsini online.
Okay, so I finally got all my bandages removed. The difference between this side and this side is like crazy. But I can finally wash my hair. It's kind of a mess. I haven't washed it. So I'm excited to go wash my hair. Okay, so I finally showered and have to apply this lotion to my stitches. I don't even really know where they're at. I'm gonna try to feel where they're at. I'm gonna apply my arnica cream.
3 months ago, I went to Tijuana, Mexico to have a facelift. My name is Nicole. I am 48 years old, and here are all the procedures I had. I had an extended neck and facelift, deep plane facelift. I had an upper and lower blepharoplasty. I also had a lip lift with fat transfer and also fat transfer to my face. I also had a tail brow lift, and this is how my scars are healing. If you take a look, you can't really see my blepharoplasty. Down under the bottom, it was very close to my lash line. You can't even really see anything on this side. Here's the scars from my lip lift. Dr. Espina was really good and followed the creases of my nose. Up in the top from my, here's a little one here that you can sort of see that went around my ear. There's hardly anything at all on the front of my ears. I had some up here. Can't see those at all. Here's a little one here, and then underneath my chin for the neck. Not sure if you can really see that, but that's quite small.
The first thing that stands out to me is how facelifts are being rebranded. They're not being presented as old school surgery anymore. Now it's called facial rejuvenation, a deep plane facelift, a neck lift, a mini lift, a ponytail lift, a lower facelift, a refresh, a snatch, a natural result. And the language matters. Because when you change the way something sounds, you change how people feel about it. Facelift sounds serious. Refresh sounds easy. Rejuvenation sounds soft. Snatched sounds trendy. And that's how cosmetic surgery becomes more approachable. But no matter how pretty the name sounds, it's still a surgical procedure. There are incisions. There is swelling. There is numbness. There is healing. There are stitches. There are scars. There is aftercare. There is a recovery period that can be emotional, uncomfortable, and unpredictable. So even if the result looks natural, the process is still real.
Day 3 of my facelift, and I've got my head wrap on right now. I don't have to wear it all day, so I'll do another video with it off so y'all can see more of what's going on. But yeah, day 3 of my brow lift, deep plane facelift, neck lift, chemical peel, fat transfer under the eye and cheek here, on the cheek here, and I had a little mole removed. So that's what I had done, and this is day 3. I slept better last night, and got up this morning. I did my vinegar wash and reapplied my Aquaphor all over my face. I cleaned my sutures, put Aquaphor on them as well. I have to keep everything moist. So I did that. I left my wrap off for a good while this morning, and I felt like I did ice everything this morning for a little while too. I did that. I'm trying to do all the things she told me to so it heals properly, and I want the swelling to go down so bad. Especially, I look like a cat lady. My eyes look so slanted. But so I did the ice thing, and then I got up, did a few things, and then I kind of felt like the pain may have started, so I'm like, I'm gonna take a pain pill and lay down, listen to my body. So I did that. I took a little nap. So I'm back up. I put my head wrap back on. She said I need pressure on my sutures sometimes during the day, not all day, but just keep pressure on them. So I put the gauze in there just to give it a little extra pressure. So yeah, this is day 3. Rocking and rolling. Let's go. Hey guys, still day 3 of the facelift, and I feel like my eyes are swelling up more now. Like it seemed like it was good this morning. Felt like it went down some, but she had told me yesterday at my first post-op, she told me that It's probably going to swell on day 3 a little bit more, and then it'll start getting better again. So I did expect this. I don't like it, but they're like really puffy, and I've been icing them. I just did another vinegar wash and put all the Aquaphor back on my face. It's thick, it's on there. So, but it's kind of hurting a little bit. I took a pain medicine earlier today, and I laid down, took a nap, but I think I may need another pain medicine because it's kind of hurting right now. It's not bad. It's not super bad. It's just like annoying and uncomfortable, I guess you'd say. I don't really feel like doing much because it just kind of hurts.
I think this is the first day that I'm slowly seeing like my old face come back. I needed to come back a little bit more. Still very extreme. I just showered and put a bunch of aloe all over my face and these little eye patches. It is still completely like a rock solid here, and you can obviously see it's not gonna be like that. It's still very, very swollen. This eye is very swollen. The forehead, even though you don't do anything to your forehead per se, mid and temporal lift, like the mid facelift, still affects like the muscles and the nerves. So my forehead has been numb basically, so your eyebrows feel very heavy and your eyes are like more closed than your natural self. So I can't wait for that to completely come back. Like you see, I barely have any movement in my forehead, and that's not Botox. That is after the surgery. I made a very conscious decision to not do Botox for a long time so that everything was out of my face before the surgery, if that makes sense.
My morning routine, 6 days post-op, deep plane face and neck lift in Turkey. Taking off my corset after a night's sleep is like better than taking your bra off. I gently wash all around my face, and I've got waterproof taping on so I can wash straight over the top of that. Then I'm going to take my medicine and my vitamins before I'm going to get a good 30 minutes of LED light. I brought this light with me from home, and it has been such a savior. So routine, I have to put these eye drops in every morning. They help with swelling. I'm also then using Phyto, and then, I don't know, pause to hold it. It's something the doctor gave me, but apparently it helps with the bruising and the swelling. So I mix them together on the back of my hands, and then I apply them to all of my bruises underneath my neck, on the top of my eyes, then let that settle down for 10 minutes. I have staples in my head still, so I've been using this iodine to basically disinfect them. So I have to do it 4 times a day, and I just put it on the back of a gauze and then just dab it on my staples all over my head. Hopefully I'm getting them out today. Now I just move on to my regular skin routine. I'm using the Rhode toner, which I love. I pop it all over my arms. Never forget your hands and your arms. And then I'm just dabbing it on the parts where I haven't put my bruise cream. I use the Medicate hyaluronic acid, and then also I'm going to use the recovery balm. It's my favorite. The post-recovery balm is just incredible. But I feel like I've lost so much moisture from like the general anesthetic and then just all of the steroids and stuff they've been putting on my face. So this has been really helping to like moisturize everything back up. Once I've done that, I have to put my corset strap back on. I hate doing this because it gets stuck to my skin and my hair. I just use toilet paper to kind of protect it. So once I've popped that on, I make sure I get it really nice and tight in place, and then I have to protect my ears, so I put some more toilet paper over my ears here, and I'm snatched in place. And now, because I've been going out and I don't want everyone looking at me, I've just bought one of these traditional scarves that they have just to kind of cover my head and make it look like a little bit more of a sleigh.
A lot of people focus on the final result: the jawline, the neck, the smoother face, the lifted look, the before and after. But the recovery is where the real story is. Because healing from a facelift isn't just waiting for swelling to go down. It's sleeping upright, wearing compression, cleaning incisions, dealing with tightness, dealing with numb areas, wondering if your face is healing normally, looking swollen one day and better the next, feeling good, then suddenly exhausted again. That's the part people underestimate. Recovery isn't always a straight line. You can look better on day 4, worse on day 10, better again the next week, and then swollen again after doing too much. That can mess with your mind because when it's your face, every small change feels dramatic. Every lump feels scary. Every swollen area feels like a problem. Every asymmetry makes you wonder if something went wrong. And even when everything's healing exactly as it should, it can still be emotionally intense.
It's been 3 weeks since my surgery today, and I wanted to give you guys a quick little update. This is what my face is looking like 3 weeks post-op mid-facelift and some portal lift. So I still am pretty swollen. The bruising has all gone away. I can open my eyes. My cheeks still feel pretty huge and numb. And my top lip, which was to be expected, the doctor did tell me that I would feel that to about 6 weeks post-op. I do feel like my right side is a little bit more swollen than my left, but I am just hoping that that will be coming down eventually. I have been doing red light therapy and I've been icing quite often, so I'm hoping that that will be helping as well. And I also wanted to say a huge thank you to everybody who followed me on this journey. I went to Turkey solo, so having you guys with me honestly was amazing. I knew this journey was going to be hard, but I honestly didn't expect it to be this hard. I think like mentally it starts to become a challenge. I am back home now. I'm back to doing normal things. I went to the gym 2 days ago and started lifting with my trainer. I'm doing Pilates. I was eating liquids for just a week, so I'm back to eating normal. I'm still swollen, so I'm excited to see, you know, how my face is going to be looking in the next couple of weeks once more of the swelling starts to come down and the numbness.
It's 24 hours after my non-surgical facelift here in Bangkok, Thailand, called an endo lift. It was created in Italy a few years ago. It came to Thailand last year. Most clinics don't have it, but the Identity Dermatology Clinic, Identity Wellness, they do have it. So I'm still swollen, but look, like, not bad, right? For 24 hours. And the bruising that I have, I was afraid I was gonna have like a black eye. It looks like purple eyeshadow. So tomorrow I should just wear some purple eyeshadow and just go with it. If I had some, I would. But I can definitely see a difference. And I had 2 people that had seen me 8 months ago. They're like, oh, what do you do? And I said, I did an endo lift. Wait till I show you the before, the pictures, because you guys always see me with good lighting. Like, I know my angles, right? So when most of you guys see me, I have good lighting, I have good angles, I contour, I always contour down here. There's no contour at all. They just use local anesthesia, a tiny little fiber, like a thread, with a little laser beam at the end, and they had different settings. And I was like, do not burn any fat from my face, please do not burn any fat from my face. That's what I was most worried about. And I didn't think I had any fat under my chin. I've done mesotherapy, which is the fat injections under my chin, which is part of the reason why I had a saggy neck, because it burnt the fat off my chin and it left me with a turkey neck. But the machine has different settings, so it can burn fat, which is why you can do it on your arms or any areas that have, like, if you, it's not as powerful as like liposuction. So like if you have a lot of fat to lose, this is not what you should be doing. But when she grabbed my chin, my neck under here, she's like, ooh, fat. I was like, oh, you found some fat. Go for it. Suck that fat out. Melt that fat down with that laser. So hopefully the lines that I used to have, these 2 lines, don't come back, because I have done alt therapy in the past and it did swell up my underarm, my neck, and then the lines came back. I hope the lines don't come back. I don't think they will.
Are you still numb?
I'm numb,
like
just
right
on under my chin. Here, I'm good. When did you have yours?
I had mine done in March.
Okay, I had mine. Oh, so you're still. So I had mine done exactly a year ago.
Oh, okay.
In June, end of
so
June.
It gets better.
Yeah, and that was the other thing when I was told, oh, it gets better as you heal. And I'm like, how? With gravity, how are we going to get better? And it does. It's like your face settles or something. It was the best thing I did for myself.
No, it looks phenomenal. And I don't think people realize how big of a surgery it is.
Yeah.
Like the recovery, I thought that I was going to be up and walking around in like a month. And no, I mean, I was down for the count. I had to like go into hiding for a little bit. Like it was a lot and so freaking painful.
It's painful. So with your brow lift, were your incisions up in here?
Yes, and then you had to pull those things out. Did you have to pull the stuff out of your head?
No, I went somewhere though. He makes his patients go to a recovery place at least a few days, and I stayed a week. And I'm so glad that I did. I don't know how anyone can take care of themselves after, even have someone. It's scary. You look frightening.
Yeah, no, it's Frankenstein. I had my whole team had to take care of me, and every day they looked at me and they were like,
I hope you made the right decision.
I'd wake up and they'd be like, it looks better.
The face isn't like any other body part. When your face changes, it affects how you see yourself immediately. You can't hide from it. You brush your teeth and see it. You wash your face and see it. You pass a mirror and see it. You open your phone and see it. So when someone has surgery on their face, the emotional side can be just as big as the physical side. Even if the surgery went well, there can still be moments where you think, what did I do? Moments where you don't recognize yourself. Moments where the swelling makes you panic. Moments where the tightness feels strange. Moments where your old face starts to peek through and you feel relieved. That's why I think people need to stop treating cosmetic surgery like it's only about vanity. Sometimes it's about identity. Sometimes it's about aging. Sometimes it's about wanting your outside to match how you feel inside. And sometimes it's about trying to hold on to a version of yourself that you feel slipping away. That doesn't make someone shallow. It makes them human, but it also makes the decision serious.
I had what he called it, like a deep plane. Yeah. I had a deep plane lower facelift, but he had an interesting way of putting it. Okay. He was like, it's the trivector of I'm like, okay,
you're
Jason,
doing all this shit.
Calm down. Just the way that he cut was not just a typical deep plane.
But it's worth it. You would do it
and then
again.
I had a mini brow lift. I do it 1,000 times over. Yeah, because what I didn't want was that whole sort of like, you're like, are you Asian? Or are you white? Yeah. But he just did a little lift here.
So you just trusted him fully. You're like
110%. Don't get me wrong. Of course I was scared.
Yeah.
But I put my faith in him, and I'm so glad I did. But here's the thing. I think women recover differently. And so, you wake up and you're like, well, Tracy was out and about at 21 days, with a full face of glam. My first, 2 weeks were brutal.
Was it very invasive? Did you feel like it was a crazy healing process?
I'll tell you what, the actual facelift itself and the neck lift I had, easy peasy, not a problem at all. The brow lift, let me tell you, that is not for the faint of heart.
Really?
That is gnarly. Oh, I don't think I would do it again.
Oh.
I know I wouldn't do it again.
Interesting.
Yeah.
Do you have to do it again once you, could you get a second facelift if you're 70?
1,000%.
Oh, you can?
It lasts for I don't know, they say 10, 15 years, a good mass or deep plane.
On a scale of 1 to 10, I experienced maybe a 1 in terms of pain. And I wouldn't even classify it personally as pain. I would say it was discomfort wearing the compression garment. It was just uncomfortable to wear that. And then I would say tingling started happening around day 6, the nerves coming back, but that was just kind of a weird sensation. I didn't experience pain. I reached out to a friend of mine who had a facelift from a different surgeon this year. And I said, did you have pain? And she said, I took painkillers the first 2 days, just to stay ahead of the pain. She goes, but I don't even think I ever needed to take them. She's like, it's crazy. It's one of those surgeries we assume is super painful. Maybe it used to be, but the techniques now, listen, I'm not trying to push into something you don't want, but I am trying to educate those of you who are asking a lot of questions.
Another thing I wish I had known prior to getting my lower facelift and neck lift, that at only 7 weeks post-op, I was going to have the loose skin reappear on my neck, which was the primary reason why I got this procedure. What is up with that?
I am Peggy, and I'm a little over 2 weeks post-op from a deep plane facelift in Guadalajara, Mexico, and I'm 60 years old. First of all, I would have done it a lot sooner, somewhere between the age of 50 and 54. Why? Because you heal faster. You're in overall better health. And your face and your body still match. Trust me, when you look 40, but your hands and your chest tell a different story, it's not good. Today's facelifts are not your mama's facelift. Cosmetic surgery has come a long way. Number 2, in my younger years, I wished I would have taken sunscreen a lot more serious, not just on my face, but on my neck, my chest, my hands, because those UV rays as you age show up and they rob your skin of all the radiance and they leave behind discoloration, fine lines, wrinkles, and crepey skin. Get a good sunscreen, wear protective clothing, and don't forget your hands and your neck. I'm totally kicking myself. Also would have had a better commitment to a solid skincare regimen. I would have started Botox and been consistent. A little consistency and maintenance, preventative, all of those measures go a long way. Lastly, start saving early. Think of it like a 401k strictly for yourself. You're worth the investment, and cosmetic surgery, no matter where you get it, is not cheap. Take your time, do your research. Every surgeon is different. They have a different approach, a different price tag. Finding the doctor that's right for you is time well spent, and it will ultimately get you the results that you want. If you're thinking about any sort of facial rejuvenation, facelift, nip and tuck, start prepping now. Your future self will totally thank you.
When I was 70 and did my facelift, I went from this to this. I wish I knew how natural the results were going to be. As you can see, Dr. Stella does not go overboard. I didn't want people to look at me and say, oh, she's had a facelift. And I didn't want to look frozen or different. I wanted to look natural. And you can see from the before and after pictures. I also don't have any noticeable scars at all. The recovery wasn't as bad as I imagined. It took about 2 weeks, from day 1 to day 14. Probably the worst part of the whole thing was getting the bill, but even with Dr. Stella, that wasn't bad. To be honest, I did feel pain in my ears, like behind my ears and my earlobes, but that went away after a few days. But like my blepharoplasty, I had no pain, and in my cheeks, no pain. The only pain I ever had was around my ears, and like I said, after about a week, 5 days, it was gone. Just lots of rest and recovery, and in 2 weeks, you can look younger and more vibrant.
This is where I think the conversation connects to the bigger beauty culture issue. Because when facelift content becomes common online, younger people are watching too. They're seeing people talk about getting facelifts earlier, hearing that if you do it younger, you heal faster, seeing results that look natural. Seeing people in their 20s and 30s talk about lip lifts, brow lifts, neck lifts, and facial tightening. And eventually, the age starts moving down. That's what always happens with beauty trends. Something starts as a procedure for older women. Then it becomes prevention. Then it becomes maintenance. Then it becomes something younger people start considering before they even need it. We saw it with Botox. We saw it with filler. Now we're starting to see it with bigger procedures. And that's concerning. Because if people are already getting Botox and filler before their face has fully matured, what happens when surgery starts feeling normal too? At what point does aging become something people feel like they have to fix before it even happens? That's the question.
Well, having a facelift in Mexico is considerably cheaper than having it in the United States. This is why I chose to have mine in the States, and would almost caution or advise to really think about it if you do decide to have a facelift abroad. Because as someone who has had a facelift, I went back multiple times after the surgery for follow-up visits to have my stitches removed 2 separate times. First the superficial stitches, and then the ones that were deeper behind my ears. That was 2 separate occasions. And then had other post follow-ups. Then also just little tiny minor things that could potentially happen with a facelift. I spit a stitch under my nose, but at the time being, the way that it presented itself, it was questionable. It was nice to be able to go into my doctor's office to have them look at it personally, make sure that it was just in fact me spitting a stitch and it wasn't, like a staph infection or something that could have been like super serious. Those are things that, anytime you have a major surgery, there is the potential for complications. And if you are having your surgery abroad and then you come home to the States, you are not going to have the support of your medical team or medical professions near you. So those are just things that you possibly might want to consider if you are thinking about going abroad just to save some money.
Just in general. So facelifts, and it's a little bit of a misnomer because I think the general population, when they hear the word facelift, they think the entire face is getting lifted, brows are getting lifted, eyelids are getting lifted, lower face is getting lifted. Within surgeons, when we say facelift, we're really talking about the lower third of the face. So it's really the jawline, depending on the technique. It could be nasolabial folds also, but when we say facelift, that's really what we mean is lower face enhancement. So that's that. But oftentimes patients do include a brow lift with it, upper blephs with it. You can do a lot of different procedures along with the facelift, but traditionally that's what we mean by a lower facelift.
I've had 3 facelifts.
How recent was the
3 months ago?
Wow. Not a scratch.
No, I gotta say.
Wow. Some people are able to charge upwards of $1 million.
I hear that there's 6 or 7 guys now in Beverly Hills that are getting $1 million a facelift from these broads. Wow. See, I'm just such a money person. I can't bring myself to do it. What I love about my D-list life is I went to Kris Jenner's last guy.
Smart.
Not the million ponytail, because they do this thing now called the ponytail where I don't know if they shave your head on top or what, but they pull your whole face up as if you were putting yourself in a high ponytail. And that's what Kris got. But I went to her last guy, but it was not cheap. You ready?
Give it.
$218,000.
Okay, I had a facelift and now my eyes don't close at the same time. Let's talk about it. For those of you who keep commenting on this like you think I don't know it, I know. They're my eyes on my face. I am well aware of what is going on here. I'm not worried about it. Neither should you be. I had 2 procedures done. One is called a deep plane facelift. As we age, we lose muscle tone in our face. And for those who will inevitably want to ask, I will be 61 in September. A deep plane facelift restores the muscle back to their position. So it's a major surgery that lifts these muscles back to where they belong. I also had a lower lid blepharoplasty, which essentially means taking out some of the excess fat that's under the eyes to make them not appear so baggy anymore. Also, some of the skin that's brought up during the facelift can be removed from this area. It's been 1 month since I had this surgery. I still have all kinds of swelling and tightness. There's tightness here when I close my eyes, especially because there's more swelling on this side. Give me a minute to heal. Again, it's been 1 month. It can take up to a year to heal after a major surgery. Another factor that is playing into how my eyes look right now is that my left eye has always been a little bit smaller than my right eye. It just is. An asymmetrical face is why I had to give up on my dream to be a supermodel. That and I am not very photogenic. I digress. This is going to be okay. Please don't worry. I'm not worried. Oh, and for people who don't think I look any different, my before videos are heavily filtered and now they're not. The big difference is in real life, because if you saw me before in real life and you see me now, you'll think I look snatched.
Another part of this is surgery abroad. A lot of people travel for cosmetic surgery because the price can be lower, and I understand why. Surgery is expensive. In some places, it can cost tens of thousands of dollars. So if someone finds a surgeon abroad with good results and a lower price, of course they might consider it.
Okay, let's break down the first 3 weeks post-facial rejuvenation, what to expect when you are going to get your face rejuvenated. So week 1. So the first night I stayed in the hospital. Day 1 through 3 was pretty much a blur for me. Quite honestly, I slept a lot. The things that I had was painful back, and they said that was from lying flat. I had like a phlegmy cough the first 2 days, and then everything in my body went dry. Dry throat, dry skin, dry eyes. I didn't bring any eye drops, and I didn't have a lower or upper bleph, but my eyes were extremely dry. Day 3, I went, and if you've followed me, you've seen that scary picture with the hemostatic netting. I went and had the hemostatic netting removed. Day 3, my physician recommended starting to do lymphatic drainage with the scar cream. So doing this 5 times a day. So massaging the face. And when I say lymphatic draining, I mean like the lightest touch when they showed me how to do it. They did up here 10 times, around the eye 10 times, around the cheek 10 times, this 10 times, and up and down the neck 10 times. And so I started applying the scar cream and doing that 5 times a day. Day 4, I felt pretty good. I went out and did a little walk, still wearing my faja. The faja is still on at this point. Day 5, I crashed. I had a very rough day 5. And I think all the adrenaline going into the procedure, traveling, the time change, lack of sleep, coming off the anesthesia, day 5, I was like, did I do? But I quickly recouped. I just took that day, stayed at the hotel. I didn't go anywhere. I rested all day. Day 6, woke up feeling great. So day 6 through 8, all about the same. I started increasing my steps a little bit. And all this time, the 3 things that I really focused on was water. So tons of hydration. Eating, even though I didn't have much of an appetite, day 1 through 10, I force fed myself, and I tried to rest a lot. So I tried to get quality sleep, which is hard when you have the faja on, you're not feeling 100% and you're sleeping upright. You need to sleep upright instead of on the side. And during that time, I would say day 1 through 8 or 9, well, probably 8. I had a lot of tightness in the neck. Okay. So I wanted to first of all, I'm a neck popper. I wanted to pop my neck, which you can't do. And I just wanted to breathe. So for me, that was a little distressing. And I know some people in the comments have said how bad is it? It's bad, but it's not terrible. Okay. You're going to be able to do it. Just make sure you have that faja on and you're putting the scar cream on. Day 8, I had the upper lip lift. So I had those stitches removed. Day 9, I traveled from Tijuana, Mexico back to Florida. 10 and 11, I just rested at home. Day 12, I started back at work. Okay. So this girl went back to work. As you can see, I still have a little bit of bruising, but I just put a little makeup on and off I went. Now, all of this time, I had been diligent about taking my medication on time. I'm still on medication for this. I'm day 21 now. So you need to be on top of your medication. You need to be on top of your hydration. Like that's the one thing I think for me, really, like I have force fed myself water, no caffeine, no alcohol until, if you guys know and watch me, I had my Taco Bell White Claw moment, but I'll talk about that in a second. No alcohol, no vaping, no caffeine. So I'm still off the caffeine, doing decaf. And if I want a soda, I drink a Sprite. Okay. So day 7 or 8, I remembered that I had those lymphatic brushes. And when I say, I don't have one with me right now, but when I say I just lightly brush over, I'm not pushing that brush in. Those to me were like a lifesaver. It felt so good because still, like right through here is still numb. Okay. So it feels very weird to touch your face when it's numb in certain places. Okay. So I started doing that, I think on day 8. And then once I got home, I started using the vibration plate, sitting on a chair and just putting my feet on it. You still get a little bit of wiggle throughout your body, but I wasn't standing on it until about week maybe day 14, 15. So right when I got home, I just was putting my feet. Then I felt confident enough to stand on it. I also started doing my walking again, increasing my steps to about 5,000 steps. Now, I'm going to say probably day 15 or 16, I started feeling like 100% again. Like my body feels 100%. My energy level is back to 100%. This is where I think some people can like get off course, or where I had my Taco Bell moment and the White Claw moment, because you feel normal again. But we need to remember that our faces, I still have stitches in my face, right? I still have dissolvable stitches. I still have numbing. I still have swelling. So it is so important that you stay regimented with the good nutrition, the hydration, the rest, no alcohol, no caffeine, and make sure that you're taking the medication as prescribed. I think that's one thing. We're spending $20, $30, $60, $80,000 to get these faces done. The aftercare is just as important as the pre-care and the surgery itself. We need to be taking full responsibility for our care. And for me, those are the things that have really, really helped me. The vibration plate, the scar cream, you're going to go through a lot more of it than you think. I'm using scar tape down here. I'm still wearing my faja when I feel like I need extra support, and I wear it at night, and I'm still trying to prop myself up. I don't have a angled pillow. I just prop myself with a lot of pillows. I'm still doing that, wearing my faja at night, and I'm trying to get work from 5,000 steps back up to my regular 10,000 steps, and just make time for that. But I think where we get off course is right around between week 2 and on. We start to feel really confident that we're feeling good again, but we're not healed yet.
But the price isn't the only thing that matters. The surgery itself is one part. The follow-up is the other part. What happens when you come home and something doesn't feel right? What happens if a stitch opens? What happens if the swelling looks strange? What happens if you need someone to check your incision, or you're worried about infection, or you have a complication? That's why surgery abroad isn't just a travel decision. It's a medical care decision. And for something as visible and serious as the face, follow-up care matters. Saving money can make sense, but not having your surgical team nearby can get stressful fast if anything goes wrong.
How soon after a deep plane lower face neck lift can you do your things that you normally do? So the first day you come home, you ain't gonna want to do shit. You're not going to want to have a bath, a shower. You're not even going to be on Netflix. The next day you may be itchy for a shower, but what I would say is, I didn't really feel like it. But had I wanted to, you are allowed to. I had a nurse for 2 days and 2 nights. This girl was not relying on her husband. He works all day. And what I would say is it was better for our relationship for me to pay someone to order around. Now, I don't have family here. I absolutely didn't want to bother friends. So this lovely nurse who was sent from my plastic surgeon's office was there to sort of guide me. And when I did take a shower on that full second day, I wanted her in the bathroom. I'm not shy. I don't give a fuck. And I felt like, what if I do get dizzy? I was still on pain meds. I wasn't dizzy, but I was a little tired for sure. You were able to go into the shower and let the water just run all over you. The only places I had stitches were right here, right along here, and behind the ear. So they can get wet. Water can touch it. You're just going to pat it dry after. It was nice for her to dry my hair with a towel after and brush it out, just like mommy used to do. You're not supposed to dry your hair. I'm going to tell you why. You're numb, and if the heat's too hot in that area, you're not going to feel it. So just get over yourself. You can't dry your hair for a while. No big deal. I would say by that weekend, I had it on Wednesday. That Saturday, I went to lunch. Now, I'm not shy. I don't give a shit if I have bruises and swelling. I felt like getting out. I was tired after. I also took a walk. I'm not a big neighbor person, so I thought it was a great deterrent that my head was this big, and I had black and blue and a big bandage on, and I kept waving. Day 7, I should not have gone back to work. The doctor said it was too soon. I went to work. I did put makeup on. Now think about it. If I just have a scar and stitches there and there, why wouldn't I put makeup here? I did. I felt tired after I went to work. It did seem too soon. But that weekend, I went to dinner. I took it easy, and by day 10, I was back at it. I went and got a hair dye blowout. I got my makeup all on. Did not get hair dye for a month. And that is just the way it is. Know this, if you have dark hair like mine, the hydrogen peroxide from surgery and some of the medications made this very white. I ended up look like Polly from Sopranos. But pretty quickly, within a month, you're back to doing whatever you want. You do light exercise, you can wear makeup, you can get your hair done, and you can get back to life.
I am 15 weeks post-op from a deep plane facelift that I had in Guadalajara, Mexico. My surgeon is Dr. Fabian Mendoza, and there's been just a few little odd, unexpected side effects. This is one, and this one is a little bit embarrassing, but let's get to it. So for this, I have to put my hair up so you can see what I am talking about. I had my facelift, my mid facelift, so they pull all of this skin up, and then you see the incision marks that go around my ear, under, and then behind. So what they're pulling here is your cheek, and if you're like me, I have a lot of fuzz on my face, a lot of peach fuzz on my face, and sideburns that come down. So when they pulled my cheek and they reattached it and sutured it, cut that skin, and then they sutured it around my ear. So now I have all of this like peach fuzz hair growing on my ear. Can anybody say like dermaplaning? Like, what? I'm gonna have ear sideburns. I mean, yeah.
People love to talk about the surgery, but aftercare is everything. The compression, the hydration, the rest, the nutrition, the scar care, the cleaning, the follow-up appointments, no alcohol, no smoking, no rushing back into life, no pretending you're healed just because you feel better. That last part matters because a lot of people start feeling normal before their face is actually healed. They want to go back to work, go out, wear makeup, work out, travel, do everything they were doing before. But feeling better doesn't always mean healed. Your body can feel fine while your face is still swollen, numb, tight, and fragile. That's why recovery takes discipline. You can't just pay for the surgery and skip the healing. The aftercare is part of the result. And if someone's spending that much money and going through that much, they need to take recovery just as seriously as the procedure.
Things I wish I knew before going in for my deep plane facelift. Hi, my name's Amber. I'm 51 years old. I got a deep plane facelift about 5 weeks ago. Number one is pain. There wasn't any because I was numb. I was so numb that I couldn't even drink through a straw when I got home and I was hungry. You'll see in my other videos, I had to close my lips around the straw so I could actually suck the protein drink in. So pain was nothing. And when the numbing wore off, well, it hasn't. I'm still numb. It's 5 weeks later, and I'm numb probably from here all the way back to about here. Everywhere I'm touching is numb. Yep, here. Anyway, it's getting better every day, and I don't mind it being numb. Another thing is swelling. I expected a lot of swelling the first week. I didn't have that much swelling the first week. And then after, my jaw was really defined. And then all of a sudden the swelling happened. So it was after week 1 and kind of got worse. And all this was puffy and I didn't see my jawline. But I'm starting to see it again. Week 5, like I said. You can see here, that's my real swelly part. And here is my real swelly part. But it's getting better daily. And you can kind of see right there that discoloration is just fluid under my skin. The other thing is exhaustion. Your body's healing and it needs energy for that. And going back to work too soon or doing too much results in exhaustion and fatigue. So rest when you can. Another thing is regarding the swelling, lumps and bumps. I mean, I got weird lumps and bumps. This is a lump. This is a lump. This was all lumpy and bumpy and weird looking. So he told me, thank God, like that first week, he goes, you're going to see lumps and bumps. They're going to come and go. It's part of the process. So knowing that was extremely helpful and made me not freak out. Another thing is just like the non-issue of needing to go see your doctor really for a while after. I mean, I saw him to get the drains out 4 days after. I saw him to get the sutures out 7 days after. And then I saw him at my almost 4 week checkup. I know I won't see him for 2 months. And it's a pretty, I mean, when you're done kind of thing, unless you have any complications, which I haven't, thank goodness. I don't look super different than I did before. I mean, this was saggy. All this looks the same. This was saggy, and I didn't really have a jawline. People said they didn't notice that. But then when you see the before and after, like if you look through my videos, there's a before and after that, you know, oh, that's why you got it done. Because people were saying, you didn't need it. Why are you spending money on that? The reason is because I didn't like the way that I looked. I didn't feel that I looked the way that I felt. The cost, the cost, the cost. Everyone asks about the cost. The cost for mine was $20,000 plus. I'm not going to give the exact amount because some people may go to that surgeon and say, well, she only paid this if you have to have a more difficult or bigger procedure, or, you know, everyone's different. So some people say that's a lot. Compared to Mexico, it's a lot. Compared to New York or LA or Beverly Hills, it's not a lot. So you go with who you feel the most comfortable with and who's maybe given you the most thorough consultation, and go by the work, you know, if you know anyone that's gone to them, or, which I do, or if you like their before and after pictures, and get a vibe from them, you know. I would never just go to a stranger that I've never met personally, because for me, that's scary. All in all, I'm happy with my decision.
Things I wish I knew before I got my deep planed facelift, neck lift, and I also had the fat transfer. You can see I'm still very swollen, and I said 4 months in my last video. It's only been 3, and I do that lymphatic massages. I do the roller thing. I've done everything, and it's still very, very swollen. This one is perfect. I don't even need to wear makeup under my eye. I love this. This one, it looks like I got beat up, so I'm trying to still work on this. But things I wish I knew. I wish that I had an ice face mask bought before the surgery. I wish that I had the chin straps, and having more than one is important for me, which I'll talk about in another video. I wish I had those before I went in for surgery. I wish I didn't spend so much stupid money on the things that they told me to get, because they thought that I would be so constipated having anesthesia, and I had zero. I have no issues going potty. So I've got so much crap in there that I would probably hopefully never need, and it's just a waste of money and I can't return it. So that kind of pisses me off. I wish that I had known information about hyperbaric chambers before I went in, and I could have had them scheduled, because I had a complication where I had necrosis. I had it here, here, and here on my neck, where oxygen didn't get where it needed to be, and your skin dies, and it could be permanent. It was a big thing. I felt like I had to do all kinds of research on my own to cure it. I am now dealing with a scar here, which is getting smaller every day. This is healed up, and this has a little bump, but it's going away, but it's only because of my research, my dedication to my health. I didn't even know necrosis was a thing, and I probably made the scars worse because I had black scabs like this big, where everybody could see, and you can't help but pick a little bit, and so now I've got indentations. But again, you can cover it with makeup, no one even knows, and they're going away, and they'll go away. It's only been 3 months, but I wish I'd known about that. I wish I was able to get into hyperbaric chamber, you know, like every day for like 7 days in a row. That would have cured it much better, faster. I didn't know about that. I did go to one. I've got claustrophobia, but then getting an appointment and paying for that extra cost, that kind of upset me. And I think I also wish I knew how your face will heal differently. You can look amazing 4 days after your surgery. I went out for dinner. I mean, you can't even tell I looked amazing. Well, yeah, because you're swollen. You see absolutely no wrinkles. You see nothing because you're swollen, and you look amazing. And then day 9, 10, 11, you look worse. And then you look great, you know, day 29, and then day 35, you look worse. It is a 1-year healing process, they say. And so therefore it's going to go through changes. I am still numb here. I'm still numb here, here, here. My neck is becoming less numb. I still get that tightness, but but now the numbness is going away 3 months. I have pain there that I didn't have. I know it'll go away, but this side of the face will heal terribly and this side will look amazing. And then the next month, this side looks terrible and this looks amazing. You can't control. Like if you could have a zit here and not a zit here, like just because it's your one face, it's not going to heal the same way. You're going to see changes here and not here and vice versa, and they're going to change. And then one thing that's very surprising are your ears. Your earlobes, the swelling of your ears are more than you could ever imagine. They literally look double in size. I'm going to show you this, like the thing I have at my house. And every time I look at it, we're all laughing. That's actually what my ears look like. See her ears? See those lobes? I swear to God, your ears will look like that. And it's going to be shocking. And nobody tells you that at the doctor's office. And last, if you have to get your hair colored because you have grays, get your hair colored before. I was probably 2 weeks out before I needed my grays covered. And then I didn't think about all the scarring and all the open wounds you have behind here from the neck lifts. You can't get your hair colored for a very long time. And so my outgrowth was just like, just disgusting. I mean, it was embarrassing. I know all vein stuff, but it's what I wanted. And you know what? I don't like gray hair.
So I think the bigger conversation isn't whether facelifts are good or bad. That's too simple. Some people love their results. Some feel more confident. Some say they wish they'd done it sooner. Some get beautiful, natural looking work. For some women, a facelift genuinely makes them feel like themselves again. That's real. But it's also real that facelifts are being normalized in a way that can make major surgery feel easier than it is. And that's where we have to be careful, because the final result may look effortless. The process is not. The swelling is real. The numbness is real. The scars are real. The cost is real. The recovery is real. The emotional roller coaster is real. And the possibility of complications is real. A facelift isn't just a beauty upgrade. It's a medical procedure that requires planning, money, time, support, patience, and aftercare. And when the online version only shows the snatched jawline or the youthful result, it makes the whole thing look simpler than it actually is. That's the cost of pretty. Not just wanting to look better, but everything that comes with chasing that result. The appointments, the fear, the healing, the swelling, the waiting, the second guessing, the maintenance, the money, the pressure to age perfectly, and to do it all while pretending it isn't that deep. But it is deep, because we're talking about the face, the part of us everyone sees first, the part that holds our expressions, our identity, our age, our emotions, our history. And when beauty culture starts making every natural sign of age feel unacceptable, it becomes easier to understand why people choose surgery. But we also have to ask what kind of standard we're creating. Are women being allowed to age, or are they being told to stay lifted, tightened, smooth, and youthful forever? Are facelifts becoming a personal choice or another expectation? Because there's a difference. A woman choosing surgery for herself is one thing. A culture making women feel like aging naturally is a failure is another. So before anyone starts treating a facelift like the next normal step, I think we need to slow down and be honest about what it actually involves. This isn't just a glow up. It's surgery. It's healing. It's risk. It's recovery that can stretch out over a year for some people. And yes, the results can be beautiful, but people deserve the full story before they decide. So I want to know what you think. Are facelifts becoming more normalized because women are being more honest about cosmetic surgery? Or are we entering an era where aging naturally is starting to feel impossible? Because from what we're seeing, the beauty standard isn't just about looking good anymore. It's about looking untouched by time. And that's a very expensive standard to live under.